So now that you're fully in menopause, do you think that you don't have hormones? You actually still have hormones. Then why would you need HRT? My name is Dr. Gabrielle Francis, and welcome to my series, Empowered Menopause. On this episode, we're going to talk about menopause and whether or not you actually need the HRT, and if you are taking it, how much you need. So let's get to it. Many women just assume that because they're in perimenopause or menopause, they automatically need HRT or hormone replacement therapy. They'll say things to me like, I'm in menopause and I don't have hormones anymore. Well, that's not supposed to be true. As we've talked about earlier, in menopause, the ovaries shut down, but the thyroid and the adrenals kick in, and they produce the 20% of the hormones that you need for your second phase of life. Unfortunately, many women don't have those 20% of the hormones because the thyroid and the adrenal have been burned out before they get to that point. So if you've ruled out that you're not a candidate, that you're safe to be on HRT, see the video that I did before. But if you've ruled out that you are safe, and now that you can take HRT, it should only be a short time. Our bodies were not designed to need external hormones. As a matter of fact, our body produces them naturally in menopause, and they're coming from the thyroid and the adrenals. So in menopause, if someone's not in that 20% range, I may recommend, if it's safe for her, that she do a small amount of HRT to keep her in that 20% range, but at the same time, we're working on the thyroid and the adrenal and other root causes of why her body is not producing the hormones. So the HRT is a short-term thing while we're getting her body to produce it again naturally.